Good afternoon, everyone, and welcome to St. Elizabeth's East. My name is Latrina Owens, and I'm the Executive Director of the St. Elizabeth East Redevelopment. Today, we are thrilled to celebrate the groundbreaking of what will soon to be another project to deliver for our residents under the leadership of Mayor Muriel Bowser. In 2008, we opened the Entertainment and Sports Arena, now home of the 2019 WNBA champion Washington Mystics. In 2019, we celebrated the opening of the first affordable housing project, the Residences at St. Elizabeth's East, 202 affordable housing units. And just 3 weeks ago, we officially opened our 801 East Men's Shelter. And if you look across the parking lot, you can see it from here. And today, we kick off construction and learn the name of a new state-of-the-art hospital right here in Ward 8. That deserves a round of applause. While today is a huge day for us, we will continue to transform this campus into a world-class destination full of mixed income, for-sale rental housing, new office and retail, and other neighborhood serving amenities. I cannot wait until we have you back in April when we celebrate the ribbon cutting of our new District Towns Townhome project, our first home ownership project here at St. Elizabeth's. Yet another example of how we are moving forward to redevelop the St. Elizabeth East campus. Now join me in welcoming Calvin Smith, our former chair of the Ward 8 Health Council.
All right. Good afternoon, everyone. Welcome to the great Ward 8. We are so happy that we are about to break ground on this new facility and talking to some good friends at GW in the district. This has been a labor of love over the last 6 years. There's a lot of push, a lot of pull, but we finally got it done, and we are extremely happy. My job today is to get out of your way and prepare room for our mayor. But first I want to give a shout out for all the healthcare providers doing work in Ward 8. Thank you for all that you do. You are greatly appreciated, and we want to continue to work with this new facility, and I'm excited to hear the new name. Hopefully it'll be shortly. And without further ado, let me invite our mayor and your friend, Mayor Muriel E. Bowser.
Well, good morning, Ward 8. Good morning, Ward 8. Good morning, Washington, D.C. I am Muriel Bowser. I'm proud to be your mayor. I'm proud to be here in Ward 8 at St. Elizabeth's East. And I am extremely proud that today we will break ground on the next premier hospital in the District of Columbia right here at St. Elizabeth's. There are a lot of people here today who know exactly what this project means for DC and especially Washingtonians in neighborhoods east of the river. But before I begin, I have a long list of thank yous to people who have made today a reality. First of all, I want to recognize and thank the council members who are here. I want to start with our host Councilmember Trayon White for Ward 8. I want to acknowledge at-large Councilmember Christina Henderson, who's here in the front row. And I especially want to acknowledge the council member for Ward 7, the chair of the Health Committee, and my predecessor who understands more than most the importance of today's groundbreaking, Councilmember Vince Gray. I want to thank all of the community members, commissioners, stakeholders who have tracked and supported our vision and helped make this moment happen. I also want to recognize my own team at DC government. I shared a chuckle with Deputy Mayor Wayne Turnage because one of my very first speeches, actually my very first speech as mayor, I said we would be here today about to build a hospital east of the river, to which Wayne looked at me and said, I guess I better get to work on that. So Wayne Turnage, please give him a big round of applause, the Deputy Mayor for Health and Human Services and Director of our Department on Healthcare Finance. I want to thank our doctor, DC's Dr. LaQuandra Nesbitt. Thank you, Dr. Nesbitt. Ben Stutz, who's working with Wayne, who has seen this project from start to finish. Latrina Owens, who is the director of our St. Elizabeth's East work. Deputy Mayor Falchicchio, our entire team at DGS, our former city administrator, Rashad Young, who I think has joined us. I see our former Deputy Mayor, Courtney Snowden, who was the Deputy Mayor for East of the River Services. Thank you for being here. I also want to acknowledge and thank our partners. There are a lot of moving parts, which I know that the council members remember well. We certainly do. And I want to thank our partners at Universal Health Services, Vice President Kimberly Russo. Give Kimberly a big round of applause. And Mark Miller and their entire team for having the vision and commitment to partner with the district. They are the national experts who will be responsible for operating the new hospital for the next 75 years. And they are making a $75 million investment in our healthcare infrastructure east of the river. I also want to thank George Washington University President Mark Wrighton, the Dean of the Medical School and CEO of GW Physicians, Dr. Barbara Bass, and Grace Spates, the Chairwoman of the GW Board of Trustees, for bringing their world-class research and medical professionals to this new facility. The GW brand and their commitment to providing excellence will be critical to our success. I also want to acknowledge my friend, Dr. Kurt Newman of the Children's National Hospital. Kurt, I want to thank you. You already know the reputation of Children's National Hospital. World renowned. I went to China with Kurt, and they knew him before he walked in the door. And they knew, more than that, the reputation for the care that Children's delivers. So thank you for stepping up to provide pediatric and infant care at the new hospital. We appreciate all the time and investments that Children has made at United Medical Center, and we are proud to continue that partnership at the new facility. So with this groundbreaking, we see so many old friends and new ones, some really old ones like David Catania, who knows a thing or two about getting here today. And Ed and Ann, first things first, let me thank we already kind of talked about the name of the new hospital, but I'm going to say a bit more. I was going to unveil it, but then I think the Washington Post unveiled it. So with the name, we are honoring, of course, an iconic Washingtonian, but we're not just honoring one person. We are honoring all the people who have fought to preserve his legacy and tell his story. We are honoring the family and generations of women, Black women in particular, who persisted, persevered, and eventually succeeded in preserving the Douglas family home. And because in so many ways, that is also the story of the Cedar Hill Regional Medical Center, GW Health. It's also the story of a community who knows their worth and who know that they deserve No matter how difficult things got, how many difficult votes we had to take, they refused to settle for anything less than a hospital that is just as good or better than any hospital in Washington, D.C. This is a hospital, a regional center for all of Washington, D.C. And most importantly, the new hospital will offer the resources that the community deserves and has asked for, and we have planned to deliver. Mothers will safely be able to deliver their babies closer to home, right here. Trauma patients can be quickly treated. Residents can come here for a full range of hospital emergency and specialty care services, including orthopedic services, liver, heart, kidney, brain, and joint and bone care, all staffed by practitioners from GW Medical Faculty Associates in coordination with the GW School of Medicine and Health Sciences. In addition to everything else, we will have access to the Children's Emergency Department and neonatal care staffed by the Children's National Medical Center. So the new regional center, like other hospitals in our city, will be a point of pride, not just for Ward 7 and 8, but for our entire city. And let's be clear, this is not just a transition from our older hospital. It is a fresh start for the community. So we all know what has transpired over the last 30 plus years. And we all know that the investment is sorely needed in the entire healthcare system. Dr. Nesbitt wants me to say this. It's not just about a hospital, right, Dr. Nesbitt? It's about the entire healthcare system, starting with your primary care doctor and your relationship with that primary doctor, and using all the good insurance that we have here in Washington, D.C. to make sure that we can lead healthier lives. So I am eager to get started and break ground on the Cedar Hill Regional Medical Center, GW Health. And before we get to that groundbreaking, I want to show a lot of appreciation for everybody who's been involved. And we're going to start with Councilmember Vince Gray.
Well, good morning, everybody. What a great day this is. A fantastic day for health care and people in the District of Columbia. I am so delighted to be able to be here this morning, to be a part of what we're launching. I want to begin, if you don't mind, my remarks with one of my favorite quotes by the Reverend Dr. Martin Luther King, Jr., which I think is truly fitting for this long-awaited occasion. Dr. King once said, and I quote, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." This quote by Dr. King is what has driven me since my return to the Council of the District of Columbia in order to be able to focus on creating a comprehensive health care system for all district residents, but most importantly for Ward 7 and Ward 8 residents who currently lack equitable access to health care services. On the western side of the city, we have some of the finest healthcare facilities and services in the entire country, and some of the best health outcomes in the entire country. We are looking forward now to be able to bring in the same way that healthcare systems and services to wards 7 and 8, and achieve the same kind of health outcomes that now are available to people in wards 7 and 8. We see the most troubling health indicators in some of the most measurable ways possible here in the District of Columbia, and that would include life expectancy, cancer outcomes, heart disease, diabetes, infant mortality, asthma, and deaths from COVID-19, which we know a lot about now at this point. We know that much of this, of course, is the cause of the work now that we have done to be able to bring together the work that we have done together and bringing together so many people who are helping to make this happen. Because of the work that we've done together, this will be the first time that the East End of the District of Columbia has ever had a true health care system for all of the people who live in wards 7 and 8 and people across the entire District of Columbia. That will include, of course, obstetrical care, ambulatory care, and 2 urgent care centers, which we've never had urgent care in wards 7 and 8, and now we're going to have one in ward 8, and we're going to have one in ward 7, and that's going to be a fantastic addition of the services that we have available to people. The creation of a comprehensive health care system anchored by this amazing new Cedar Hill Regional Medical Center, the GW Health, is one of the best ways that we can bring the kind of services to people that they desperately need and they desperately deserve. It is one of the best ways that we can bring services in ways we needed to people in the east end of the city and in the District of Columbia. I want to thank you, Mayor Bowser, for the partnership that you've provided, and it's been delightful to be able to work with you to be able to get to this point. We can probably smile at this stage because, boy, do we have some tough days in getting to this point. But we're here. We're here. I also want to thank not only Mayor Bowser, but I want to thank Deputy Mayor Turnage, Deputy Mayor Falchicchio, former city administrator, our former city administrator who's here with us today, and I'm glad that he's here, and that's Rasad Young, of course. I want to thank Ben Stutz. I want to thank Kimberly Russo, who, of course, has been a great partner in helping us to get to where we are today. And I want to thank all of my staff who worked so hard to be able to get us where they are today. And I'm going to ask you if you all would join us in thanking Eric Goulet. Eric has been a fantastic, wonderful partner in helping to make this happen. He works very, very hard every day. I am proud of him. I'm proud to work with him every day. And boy, he has been such a partner in helping to make this happen. So please join me in giving thanks to Eric Goulet for the work that he has done as the head of our health committee. So I just want to thank you all very much. And now we'll join let's see who we're bringing up next. I think my partner in Ward 8, Trayon, are you here? There he is. Please join me in welcoming Trayon White, Councilmember for Ward 8.
So good afternoon. It smells like a new ward today. It feels good today. Give yourselves a round of applause for joining in this beautiful occasion today. I want to thank our Mayor, Muriel Bowser, for leadership. I have a few thank yous. I'm going to go through that real quick. Ms. Russo with University Health Services and GW. Every time I call Kim, she's always responsive, always listen to my ideas and ways we should integrate the community into this project, not just with jobs, but also with careers. I want to thank Mr. Newman from Children's National, Ms. Smith from Bridgepoint. Mr. Smith, I'm sorry, what Calvin? From Bridgepoint, that's my guy. Deputy Mayor, and all who was involved. I see we also have Councilmember Christina Henderson here as well. But I want to give a special thank you to Councilmember Vincent Gray. It was in 2017 when I came on the council. Vince pulled me to the side and he said, "Trayon, we have to be laser focused on this." I'm like, "What is this though, Vince?" You know what I'm saying? This. That's a minute. And he was talking about this hospital, right? And he wasn't just talking about a hospital, he was talking about a healthcare system. And I was like, okay, Vince, you know, I'm focused on public safety and schools and all these other things. But I'm happy that you were able to see this day, man. Because I know how you labored and toiled and it got derailed and you got back on focus and it's coming to fruition, man. And I'm happy, more happy for you than I am for myself. Because give him a round of applause, man. There's an old saying that you can't accomplish anything that you're not committed to. And this man right here has been committed since the beginning, man. And I just want to thank you for being dedicated, because there are thousands and hundreds of thousands of people that's going to benefit from this quality healthcare system right here in Ward 8. You know, we have some of the highest health disparities per capita in the country as relates to what we go through our healthcare system, even what we saw through the COVID pandemic. And people having, you know, going across the city to get their services, and our seniors have to travel and complaining about, you know, they're traveling through the pandemic. We know we're going to have those services right here east of the Anacostia River for our residents. So I want to thank you. I want to thank all those that's in the audience that played a part, that's typing and writing and doing policy to get us here today, because we're really in the business of saving lives. While we're talking about a hospital right here, it's really about the lives that's going to go here. And maybe a baby that get a scratch on his leg or whatever don't have to go all the way across town to get services anymore. Can come right here, and there will be a real trauma center here. That was the number one question. Will there be a trauma center in Eastern Anacostia River? Y'all heard that question? If you didn't, you wasn't listening. I'm proud to say there will be a state-of-the-art trauma center right here, East Anacostia River. So I want to thank all those involved in getting us here today, and I look forward to the work of making Ward 8 greater. Thank you, and God bless.
Let's give another big round of applause for the members of the council. And I am pleased to introduce a woman who has been steadfast, strategic, tough, and smart in getting us here in this partnership with the District of Columbia. So please join us, Kimberly Russo, the Vice President for Universal Healthcare Services and CEO of the George Washington University Hospital.
Thank you for that lovely introduction, Mayor Bowser. What a day. What a day. Good morning, everyone. It's so wonderful to see all of your faces during this historical moment. For those of you who may not know me, that I've not had the pleasure of meeting, I am Kimberly Russo and have the pleasure of serving as the Chief Executive Officer of the George Washington University Hospital and as the Group Vice President for the Washington, D.C. region for Universal Health Services. It is truly an honor to be here today as we embark on this exciting new step towards elevating healthcare in Washington, D.C. and better serving our community. As many of you know, over the past several years, we have proudly partnered with the government of the District of Columbia on this important initiative to create an integrated academic medical network of care to better serve the needs of our region with the district government and the continued partnership with our academic and clinical partners, the GW School of Medicine and Health Sciences, thank you, Dean Bass, and the GW Medical Faculty Associates, and Children's National Hospital. We have collaborated on a plan to enhance healthcare in our city. The new hospital at St. Elizabeth's is a significant component of the comprehensive plan that also includes the development of 2 urgent cares, physician offices, and ambulatory services that are easily accessible by all. Far too long, residents east of the Anacostia River have had inadequate access to important healthcare services, resulting in healthcare inequities and lower healthcare outcomes. This is simply unacceptable, and we must do better, and together we will. As part of the comprehensive integrated academic network of care, this new hospital will help to improve health care in our city by bringing services closer to residents east of the river. The new hospital will be a verified trauma center, thank you, Councilmember White, as well as offer care for a range of needs, including some of those you heard today. It's for kidney disease, wound care, general surgery, mental health, and so much more that we're so proud to offer. It will feature an ambulatory pavilion for outpatient care, physician services, and imaging to assure that you have state-of-the-art access to care. In the first year of operations alone, the hospital is expected to serve over 40,000 patients in its emergency room, care for 5,000 inpatients, and deliver more than 2,500 babies. We will also provide outpatient services to nearly 9,000 patients. All of these services are fully integrated into a system of care that includes GW Hospital and Foggy Bottom, and with the new urgent cares and ambulatory services that are currently under development. The development of this comprehensive system will allow individuals to get the right care at the right time in the right location. By improving access and creating a streamlined system of care that is integrated, we will enhance the access to health care, equity, as well as the outcomes for our DC residents. In addition to the new hospital, we are also going to continue our tradition of excellence and our commitment to research and education. UHS will continue our longtime partnership with GW School of Medicine and Health Sciences and the GW Medical Faculty Associates, serving as the academic and physician arms respectively. Furthermore, we are also so pleased to continue our partnership with Children's National Medical Center for the delivery of high-quality services to include pediatric emergencies, well baby care, and neonatal intensive care east of the river. As an academic medical center, we will continue to train the next generation of healthcare professionals, and we will dedicate substantial resources to research and education in order to improve health outcomes and diminish the care inequities that we've experienced. We look forward to collaborating with many of you on all of these services to better serve our city. This is truly an exciting advancement for healthcare that is really a watershed moment for many. It has taken significant time, dedication, and the hard work of many individuals to get us where we are today. It is super exciting to see this coming to fruition. I want to also express my sincere thanks to all who have supported this effort and who have been pivotal in making this a reality. Specifically, I would like to extend thanks to Mayor Muriel Bowser, to Deputy Mayor Wayne Turnage, to Councilmember Vince Gray, to the associated staff of so many city officials, as well as the previous city administrator, Rashad Young, and all of our partners at the district government, as well as GW University, for their commitment and continued partnership in this vital effort to continue delivering high-quality health care. Today marks an important day for healthcare in our nation's capital. As we break ground on this new facility, let us recognize this moment of hope. I have no doubt that this hospital will be pivotal in changing and improving healthcare in our nation's capital, and together we look forward to what's on the horizon. Thank you all for being here today and for also your commitment to really making sure that we join in on making this a reality. We are here to commemorate this important advancement of healthcare in DC. And at this point, I'm honored to introduce our GW University president, Dr. Mark Wrighton. Thank you all.
Good afternoon, everyone. I'm delighted to be here, and I need to acknowledge right away that I have not contributed much work toward this important innovation in the nation's capital. I arrived as president on January 1. I heard about this very exciting and important development just after the public announcement of my appointment back in the fall, and I am so grateful that George Washington University has been called in as an important partner in this very significant development. So on behalf of George Washington University, I extend my deepest thanks to Mayor Bowser and her entire leadership team for working closely with all of us in the community to get to this important moment. I look forward myself to working alongside the great group of people who have already been recognized. I know that we have much work to do to bring reality to the vision behind me. The implications for Ward 7 and Ward 8 are tremendous. George Washington University has already made an important contribution to the education of Councilmember Vincent Gray. And we're very proud that we have many distinguished alumni, but none more important in connection with this project than what you have done. So thank you very much. At George Washington University, I have found that we have a tremendous leadership team, and I am fortunate to have been mentored by our former president, Thomas LeBlanc, who joins us from his time in Miami, Florida. We arranged relatively warm weather here, but I would like especially to acknowledge Tom LeBlanc for his great leadership in connection with this particular project. Tom, thank you very much. And of course, he's been assisted by leaders at the university. These include now Dr. Barbara Bass, who is the Chief Executive Officer of the Medical Faculty Associates and also the Dean of the School of Medicine and Health Sciences. Together with Mark Diaz, the Executive Vice President and Chief Financial Officer, we have a great team, and we have many outstanding members of our faculty. Those medical clinicians are going to make important contributions to the well-being of our entire community. I would like also to express thanks to Kim Russo and to Children's National Hospital, led by Dr. Kurt Newman. These are important institutions with which we are partnered and we will depend on as we look ahead. As president of the George Washington University, I've acknowledged that I haven't done very much in connection with this project, but I pledge that we will be actively involved as participants in providing the medical care this community so desperately needs and deserves. I am grateful to have this opportunity to speak with all of you, and I look forward to our work together. I would like to again thank Mayor Bowser for her leadership in bringing this to reality, and also I would like to thanks to all of my colleagues at George Washington University for your tremendous help in welcoming me to this community. Now I would like to introduce the 2021 CEO of the Year here in the District of Columbia, the CEO of Children's National, Dr. Kurt Newman.
Well, thank you, President Wrighton, and good afternoon, everyone. I don't think you can see it from where you are, but this is just the most amazing, distinguished crowd I've ever seen. And Madam Mayor, thank you for making this happen. You know, I knew she was powerful. I knew she was the greatest mayor of the greatest city in our country. I didn't know that she could change the weather and bring the sun out. So thank you for that. But it's just privileged. I'm privileged to be here with all the council members, distinguished guests. I see a lot of my colleagues, the CEOs of all the hospitals in our city, and just the community that has turned out for this great day, this groundbreaking, state-of-the-art facility. I think about the future and the children that will be cared for here, the families, the community, and beyond. And groundbreakings are special days because they give us a chance to look forward and think about the past, but really think about the future and what will happen here. It's a vision, and many people had this vision, and to see it coming to fruition, to reality, is inspirational. At Children's National, we're proud. We've been part of Washington, D.C. for 151 years. We were going to have a birthday last year, but the pandemic moved it to 151. So hope you all celebrate with us. But we're proud to be currently providing emergency care at United Medical Center, at our two major clinics, one in downtown historic Anacostia and the other at the Arc. And to Dr. Nesbitt's point about being part of a health system, this hospital will now become part of a health system for children. And we're so excited about that because we can provide the highest quality pediatric care to the children of this community. That emergency department that serves 30,000 children a year right now, and then you think about the creation of a new neonatal intensive care unit aligned with the maternity unit that will provide the top neonatal intensive care. And if I might brag for a moment, Children's National is ranked #1 in neonatal care in the United States. Now we'll be able to provide that service right here in this community. Mothers and babies won't have to leave this community to get the best level of care. So I wanted to thank my partners at George Washington University Hospital and George Washington University. It builds on our academic relationship that we already had. And I see just great future in what's going to happen here. You know, we're in this community, and it's an honor for me to think about the name of this hospital, to think about a quote from Frederick Douglass that I think we all know, but it really means a lot when you care for children, that it's easier to build strong children than to repair broken men. We have the opportunity to do that here, to create a healthier community and help those children and families grow up stronger to be healthy adults. This hospital helps us live up to that ideal. So it is my great pleasure to introduce our next speaker, Kenneth B. Morris, Jr. If you don't know Kenneth, I want to let you know that he is the great-great-great-great-grandson of Frederick Douglass. And he is the great-great-grandson of Booker T. Washington. He is the president of the Frederick Douglass Family Foundation, which is a public charity that endeavors to create a modern abolitionist movement in schools all over the country through the vehicle of service learning. Kenneth is a true servant leader, and he's working hard every day to fulfill Frederick Douglass's legacy of upholding the inalienable rights of all members of the human family. So everyone, please help me welcome to the lectern Kenneth B. Mars, Jr. Kenneth.
Thank you, Dr. Newman, for that very kind introduction. I am very honored to be here this afternoon. Good afternoon, everybody. It is wonderful to stand up here and look out into this crowd and to see so many people, and I know everybody here had a hand in making this a reality. And I feel so privileged to be able to represent the family of Frederick and Anna Murray Douglass and the naming of this wonderful facility. Mayor Bowser, thank you. I really appreciate what you said about the hospital name, not only connecting to the actual physical place of Cedar Hill, but also being connected to the work and legacy of the amazing women who helped preserve the home at Cedar Hill. We at Frederick Douglass Family Initiatives have long been focused on lifting up the legacy of people like my great-great-great-grandmother, Anna Murray Douglass, her daughters, and others in the family who have not been recognized for their roles as radical freedom fighters in their own right, working alongside Frederick Douglass. There would be no Frederick Douglass without Anna Murray Douglass in his life. They were married for 44 years. They had 5 children together and 21 grandchildren. And she was one of the first people to plant the seed of thought in his mind while he was enslaved with the name Frederick Bailey, that you are not meant to be a slave for life. And as they started to think about having a family together, she said, Frederick, I don't want our children's father to be a slave. Had she not sold her personal belongings to help finances escape, had she not sewn the sailor's disguise that he would wear, who knows if he would have had the courage or wherewithal to run away from slavery, and had we not had the contributions of Frederick Douglass as the great abolitionist, we would be a very different country sitting here today. So I am just as proud of Anna as I am of Frederick. Over the past week, we celebrated Frederick Douglass's birthday and the Douglass family during our second annual Douglass Week celebration and commemoration in partnership with Ireland. Douglass traveled to Ireland in 1845 and 1846 after the publication of his first autobiography. The notoriety he received from that best-selling book threatened his freedom, so he traveled to Ireland as a kind of cooling-off period. During the week, I had an opportunity to participate in 2 Douglass Dialogues conversations where I engaged with Douglass scholar Celeste Marie Bernier about the amazing efforts of the Douglass family prior to and after the Civil War. So this week has been all about family for me. Cedar Hill was important to the Douglass family. It was a place special to Anna in particular, and it's beautiful to know that a place of such family comfort and meaning will be associated with a place that will provide much needed comfort and care to Washingtonians in this important part of the city. So on behalf of the family of Frederick and Anna Murray Douglass, I thank everyone who had a hand in making this a reality and for honoring my family by naming this Cedar Hill Regional Medical Center. Thank you very much, and I would like to invite Mayor Bowser back up to the stage. Thank you.
What incredible words. Thank you. Thank you. Gave me goosebumps. Well, we did it, and congratulations again. I see our former council member for Ward 7, Yvette Alexander, who also chaired the council's health committee. Sandy Allen, our former council member for Ward 8, has joined us. I know that representatives of the D.C. Hospital Association and Primary Care Association are also here. And I listened closely, and I don't think anybody mentioned when we were going to open. So this is part of my job. We're going to open in 2 years, right? So at the end of 2024, we're going to have a hospital here. And I plan to come back and cut the ribbon as mayor. I'm going to come back anyway, but that's how I plan to come back. So let me now, I'm going to take a couple of questions on topic from the press. We're talking about a hospital. Then we're going to cut the ribbon, break the ground, and then I'll answer any other questions you have. Questions? Sam? And I'm going to invite my team to join me up here. GW, Wayne Turnage. Council members, don't get away. Okay.
So the level of care at the United Medical Center that is still here, I've heard that in some cases people are waiting hours if not days to get treated or seen in the emergency room, that there doesn't seem to be enough medical personnel on the 8th floor. I understand where the patients are. To what degree is the city going to, let's say, maintain quality at United Medical Center until this hospital is completed?
Well, Sam, that's a great question. And, our commitment has been to maintain United Medical Center until we open a new hospital. We are working with some constraints that were triggered by a financial kind of oversight committee. So we're working within those constraints. The hospital has also been impacted by staffing shortages. But we maintain and will continue to provide oversight to the hospital to make sure quality services are provided until we open the new hospital. Any other questions? Press question? Yes, ma'am. Yes, ma'am. Okay, if you step over, we have a microphone.
Good afternoon, Ms. Mayor.
Good afternoon.
Deborah Bailey, Afro-American newspaper. Given the fact that wards 7 and 8 are still huge, and this is such a wonderful addition, the transportation services for residents to really utilize this facility need to still be lined up. So what's the plan to ensure that transportation, even for wards 7 and 8, to make sure that everyone in these wards has access to this?
Sure. So that's a great question, and I don't have all the specifics of the transportation plan, but it's something that we always consider when doing a new development. And we have the opportunity here, especially because we've made over $50 million. As you look around, you see cranes all around you. We're investing in the infrastructure here. There will be parking here that we are building that serves this campus. And of course, this campus is served by public transportation.
Mayor Bowser.
Yes, where
James
are you?
Wright with the Washington Informer newspaper. Just want to make sure that this project will have CBE participation as well as minority and women's businesses.
Well, thank you for asking that question, because you know what we do. We have gone from spending $300 million, about $330 with CBEs in the District of Columbia in 2015, to spending over $1 billion with our CBEs in 2021. So we've grown opportunities in the district, and as a result, we see our companies growing as well. I'm going to ask one of our team members to talk about our business participation in this project. Wayne?
The construction side of this project will have $100 million in CBE spent. Thank you.
Mark?
I had a question about the trauma center. Can somebody expand a little bit about the trauma center? Specifically, what level trauma center will it be here?
Sure. Kim?
Thank you for that question. So the trauma center will be verified as a level 3, which will be able to treat approximately 85 to 90% of the traumas that actually occur here in Ward 7 and 8.
So level 3 is the lowest level. Was there any consideration? Why not a level 1? Does it level 3 handle gunshot victims?
So it's a great question. And when we looked at the gunshot wounds that occur in Ward 7 and 8, again, about 85% of those could be treated at a level 3. Part of the determination of the level of trauma is really around the research and other components that would be of prohibitive nature. But level of trauma, we're still going to have available 24/7 orthopedic neurosurgery to be able to treat those patients that come through the emergency room. Thank you.
Okay. Thank you, everybody. So let's break the ceremonial ground.
Look up here, everyone up here, stop staring.
Everybody up the ladder, everybody up at the ladder. There we go.
Okay, Cedar,
hold on.
Now don't be shy.
Okay, 1, 2, 3.
Cedar!